Jason has had pain for over 3 decades and has lived over 90% of his life with pain. He is only 38 years old and has visited several pain clinics throughout the country, as well as seeking advice from a multitude of health professionals. So Jason, can you describe the pain you experienced?
Yeah, it was torture. Every morning I would wake up in agony, and through the night as well. 3-4 times a night waking up is pretty average, or was average. So when I'd wake up in the morning, I'd be in so much pain that I'd just lie there, and eventually I'd get up mid-morning and sort of shuffle around and do what I need to do to try to get up a bit of energy, and then just sort of do as much as I can through the day, which if I was in a lot of pain would mean not much, usually either going back to bed or just lying on a couch, or and I couldn't even read or do anything like that because the pain's just too intense. Sometimes the pain would get so bad that it felt like someone had like a saw in my stomach, just going back and forth, or around near my hips, just back and forth, and it wouldn't stop. And if Janine was home, I didn't want her to hear me screaming, so I would turn up my music, which is quite noisy music, and curl up on the floor, usually under my desk, and just scream for about half an hour until the pain sort of just got a little bit less. And after that, I'd just be ragged. I'd barely walk, barely do anything, usually to bed and start the day over again. Yeah.
It is a long time to experience pain, Jason. Did you seek help?
Yeah, my mum, when I was sort of about 5 or 6, took me to hospital, trying to find out what was going sort of on. I don't remember too well what went on, what sort of treatment I had back then, but after a while I stopped going to hospital and just sort of continued on with life. And then it wasn't until, over more than 10 years ago now, that things started getting pretty bad, and I had to start seeking some serious help. My pain was keeping me bedridden, so I went to a local hospital after I actually went to my GP first, and he thought it was stomach gastro related. From there I went on to Waikato Hospital to see
I think it was the general.
Yeah. From there I went to the Auckland Pain Clinic, and I also had a colonoscopy, saw a urologist. What else?
You had your exploratory laparotomy.
For adhesions, which there were none. And from there I've been to many pain clinics, from Auckland to Timaru to Wellington, and also outside of sort of, I suppose, accepted medicine, I've also looked at sort of the weirdest parts of medicine and sort of some strange doctors who had some strange ideas about what was going wrong with me. I suppose the only thing they really got me doing was just eating better, but they didn't help at all.
What advice have you been given from the pain clinics?
The first pain clinic we went to was Green Lane. We went there on the recommendation of a sociologist.
I think so.
Yeah, who was she helped us out of a pretty bad situation. And I saw, I don't know who the doctor was that I saw there, but I saw whoever was top at the time, and he seemed to know exactly what was wrong with me when I explained my symptoms to him, and he explained that I had a neural sensitization disorder. Gave me a big wad of papers about this condition, and recommended that I start taking some gabapentin. because it was related to the nervous system and that sort of thing. That's what gabapentin was for. So it wasn't funded at the time, so we started buying that.
What did you understand by the term nervous system sensitisation?
Basically that it was just something that really couldn't be found, so it was, I thought it was really just sort of in my head. There's nothing they could really physically find wrong with me.
And did you feel that this was an adequate explanation at the time?
I suppose. Looking back, no. At the time, it was when he pulled out the documents and he talked about the doctor at the Green Lane at the pain clinic, when he talked about seeing other people with the same problem as me, but they would have pain in different places, but they couldn't find a physical reason. And then he pulled out all those papers that I could barely even understand because they were quite medical. I just figured it had to be true. I'd done everything else. They'd cut into me, they'd stuck things in me, I'd taken all the pills, and so, yeah.
And how did this impact your occupation?
I was basically working part-time and not making very much money. Most of my work was through the internet. I couldn't really leave the house too much. So my occupation was pain.
So for many years you had no income. It must have been tough financially, not having any income and paying for all of those treatments.
Yeah, it was really tough. We were basically just a one-income household. When we had to fund the gabapentin, I think it was more than $200 a week.
It was quite a lot of money.
It was extreme, and we were living in Auckland at the time. And it pretty much nearly broke us as a couple. It was some pretty rough times with that, because paying a lot of money and then we weren't getting anything out of it, and as a result, I sort of got to a point where I required a bit of an intervention psychologically. I was just a bit tired of it all, and that's what got us onto a sociologist who started trying to help me get into the pain clinic at Green Lane and see a urologist and all these other bits and pieces just to help out.
And what about you, Janine? How did you find the whole experience?
Yeah, really difficult. You want to be able to help, but essentially there's nothing that you can do. You can try and make things easier in how life is. Not asking too much of Jason, doing stuff yourself, and then eventually not, just basically I've continued to be active, but I haven't involved Jason because I know that he just can't. So now it's me tramping, finding other people to tramp with, or just going on my own. It is very tricky, and you kind of have to just keep going on. You can see the immense pain that he's in, but at one point I asked him to stop telling me about it, and that's really difficult.
Then Janine landed a job in Wellington, and this led you to the Wellington Hospital Pain Clinic.
They referred me to a pain specialist, Dr Kanji.
I talked to Jason and took a story, and this alerted me that his hips may be a source of his pain.
We went to his clinic and he pulled up an old scan that I had for kidney stones a few years back.
I proceeded to look at Jason's kidney scans that he'd had in 2011. And these showed his hips at the periphery. And the scans showed it looked like his hips were worn. There was some cartilage that had thinned.
And he pretty much immediately spotted something. I was a little disbelieving because I've had a lot of doctors initially point out something.
Jason's MRI confirmed his diagnosis of hip pain.
The pain is, well, it's always tended to move around, but mostly it's focused on my hips and my stomach area.
The MRI scan showed narrowing of the cartilage as well as the presence of cysts in the adjacent bone. Once cysts are present, a joint almost always causes pain. Pressure on the bones in the joint is normally absorbed by the cartilage, but was thinned in this case, and this created the cyst in the bone. The pounding on the hip joint on the cyst was creating electrical signals which were travelling to the brain and experienced as pain. This was creating Jason's pain for over 30 years. And then we started managing Jason's hip pain. Basically, if we relieved the pressure on his hip, we would get less electrical signals emanating from the hip joint and from the cyst.
After that MRI, when Dr Kanji brought it up, it's just good to see it in black and white. And that it's not in my head.
So, Jason, now that you have a diagnosis and know where your pain originates, tell me what has happened.
Oh, my life's changed quite remarkably. Initially, well, I stopped taking medication for one, so that was a huge thing, and I began a physio as well as regular swimming, sort of aqua jogging, and also using a sauna. And I have minimised my walking, which is a big part of my pain, so I limit what I do, but the pain has become much more manageable. I haven't experienced extreme pain for quite a while now, which is, it's a good feeling.
And Janine, what changes have you noticed with Jason?
I guess the biggest change that I've noticed is his change of attitude, that, you know, it's not all in his head, that he's got a different perspective on life now. He's actually sleeping much better, which means that I sleep better, which is great. He's not getting up in the middle of the night. I'm not finding him on the floor or anything like that. Just huge, really. I'm just really appreciative, actually, that we've now got something that we can pin this on, and we can deal with it. We've dealt with it before, but now we actually can properly deal with it. We can, and there's a solution at the end of the day.